Today we will talk with Dr. Beata Sowinska, owner of ABM Dental Office in Mississauga, about reality and expectations in dentistry. We have certain dental procedures and we wonder what to expect.
Yes, hello everyone. We are creating right now a very weird, unrealistic world around. Everyone are living in the virtual bubble, and we are kind of separated from reality. And our body is not getting up to the speed. We are expecting everything easy, pain-free, stress-free, fast. And our body has the same healing properties and same physiology as generations before. So not so fast, not so furious, not so easy.
So it's not like fixing the car that
no,
you
it's
have
not.
to fix and
no,
it's ready to go.
Processes are still the same, and like even if we have expectation that it will be easy and fast, it doesn't work this way.
So if I had just a new filling, what may I feel?
Some people they don't feel anything, and some of them are you can expect that there will be some feelings because we do resin restorations on the live tissue. So the tooth has innervation, it has the vessels inside, and it will react like the normal other tissue of the body. So expectations that you walk out of the door and nothing will happen, that it will be no pain, this is not really based in reality, because the dentition is actually part of the cranium skeletal system, so it's like a part of the bone. So we can expect that for example, if someone breaks the leg during sport, during skiing, no one expects coming out of the surgeon office or from the hospital that, wow, I'll be using this leg or I'll be using this extremity immediately. No, the healing process is 3 months, and the same also applies to the dentition. The teeth are healing slowly.
A lot of time the caries are located between teeth, and the contour form and wedge are used to recreate shape of the tooth. The wedge spreads the teeth a bit. After numbing wears off, I may feel that I'm not biting correctly. What to do? Should I wait?
No. Definitely not. Yes, it's correct, but we're using the wedges. The wedges, tiny amount of the distance is created between both teeth. The ligaments are stretched, so it takes time for the teeth to come back. It's about 24 hours. So definitely, anyone who has the filling done and feels that the bite is a little bit off, they have to come back to have the bite adjusted to the proper position, which is achieved after 24 hours.
What about kids? Let's talk about pediatric patients. What are the difficulties while treating the youngest? Especially the behavioral management. Sometimes children are reading the parents, and they look at the parents, and if a father or mother is scared of dental procedures, of course it's also reflects on the behavior of the child. But a lot of parents right now are choosing wide restorations, and they choose them because the wide restorations are more aesthetic, but also they are amalgam free. The resin restoration is bonded to the teeth like Velcro, so the bond has to be created, and the bond and the procedure which accompanies it is very sensitive to the certain factors, like area field of the procedure has to be clean of saliva, it has to be less moisture, and of course when the child is wiggling, when the child doesn't behave, or is moving the tongue, it's very difficult to achieve this ideal situation. So a lot of times I recommend that the patients, parents of the patients at home should check the filling if it's still intact after a couple weeks, or along the road even after a couple months, because it might be lost, and the child might not recognize, might not be aware that the filling is lost, but
but the hole will be there, and the food might, you know, like go inside and create more damage to the tooth, and it will be even root canal needed.
What about leaving it untreated? Can a rotting baby teeth affect permanent?
Definitely, and it's a very important issue to understand for the parents, because a lot of parents are thinking, well, deciduous teeth, baby teeth are going away. Like, you know, like they will fall out and they are not necessary, so why should I pay for the treatment? And the treatment is necessary because we have underneath, we have the teeth which are growing, the permanent teeth, and the health of permanent teeth is dependent on how healthy was the primary dentition, because a lot of times the processes of the caries are spreading because the permanent teeth are not growing simultaneously. So the sixes, those are the first molars, are coming earlier than the other teeth, so they're longer in the mouth, and if the other dentition, the deciduous teeth, are with caries, the caries might start also on those permanent teeth, and this is why a lot of adults lose sixes, the six molars, because of this.
Any filling, no matter what size or depth, may result in the need of root canal. What patients should look for?
Yes, and this is funny because sometimes I have patients which have like huge holes, and I feel them, and I'm thinking, and I'm putting actually the note in the chart, oh, this might be a root canal, so patient is aware of it, and they never have any problems. And sometimes I have the patient who has not very big filling, and the tooth ends up with a root canal. So, you know, like the necrosis of a part can be caused by a lot of factors. So patient usually, when we do the feeling, some sensitivity, as I mentioned before, is normal, but when the patient starts feeling like longer sensitivity, more than 8 weeks, and it's sensitive to hot, especially very, very hot, and this perception is longer, the pain doesn't go away, or pain which is on the cold, but it has to be longer than 30 seconds, and it doesn't go away. So this is like pointing to that, you know, this might be a root canal. And of course, you know, like when the tooth is, like the pulp is already destroyed, there is a formation of the pus, of the abscess in the bone. So when the patient bites on the tooth, a lot of times when, you know, like when it's a beginning of a necrotic process, we have to really look for which tooth is affected. But when there is already pus coming out of the tooth, patient is pointing, this tooth is paining, this, and not anyone. So like before, because the tooth sticks out of the socket and it's a little bit higher, so when the patient bites on it, it's very painful.
How the deciduous teeth are treated when painful?
When painful, and when they have, for example, root canals. The root canals are similar to the adult teeth, but there is only pulpotomy, because we have to remember, under those roots there are forming permanent teeth. So we have to just cut the nerves in the chamber, but we don't do down the roots because we don't want to damage the permanent dentition. So it's a pulpotomy. It's a root canal, but a little bit different.
Some teeth are very fragile due to the extent of caries. What happens if the tooth has a huge filling in it?
This is true, but, you know, like sometimes, you know, like we have recurrent caries, so, you know, like we already have the tooth treated and the tooth is healed again and again, so it's less of every time we cut the tooth, it's less of the structure and less of the structure. So sometimes we propose inlays and onlays which are done in laboratory. So, you know, like the fillings which are big may also be replaced by crowns, because crowns is strengthening the tooth structure.
Well, that's the question. The crown is like a cap on the tooth. What materials are used to strengthen the tooth structure?
Yeah, it's very important. So we choose materials which are, of course, with properties which are, you know, like working for us. So, for example, we use the feldspathic porcelain, or we use the zirconia. And zirconium oxide crown, it's a ceramic material which is much stronger than a lot of metal alloys, and also has very nice physical properties, because everyone knows that when we age, our teeth are shorn off because we're grinding and it's normal process of eating. So there is some degradation of the occlusal enamel. So zirconia kind of follows the natural processes, and it doesn't have the shards, and the edges are smoother, so it doesn't destroy opposing dentition.
So going back to root canal, what are the expectations after root canal therapy?
Well, after root canal, we have to remember that we're starting with inflammation already, that there was some sickness, that was a problem with the tissues. So we can expect that it might be some pain, it might be some sensitivity, it might be sensitivity to the biting, it might be some swelling, because like as I said, there was an inflammation existent already. But a patient has to call us, especially if it's more swelling occurring, and we prescribe antibiotics, to control the inflammation. Also, we have to remember that when we are opening the tooth structure is, we have less tooth structure. So the teeth are like kind of a shell. They are very crumbly, they are very fragile to bite. So we have to remember not to bite on the teeth which are during the process, because we have temporary filling. And also we have to remember that the temporary fillings are not bonded to the tooth structure, so they may reinfect. Bacteria may go through those small cracks. Those are not visible cracks, but they have an entrance to and they can reinfect the root canal system. And later, as a standard of care right now, we do the post and crowns to reinforce the lost structure of the tooth.
So, summarizing our discussion, patients realistically should expect at least one symptom after dental treatment.
Yes, that's true, and it's unfortunate. I wish that we would do it any other way. We're trying to speed up the process. For example, we're using diode laser to heal up the sockets after the surgeries, or we're healing up the lesions when patients have a herpes labialis, the cold sores on the mouth. But unfortunately, realistically looking at life, yes, every process is slow, and we have to take time, and actually acceptance of this helps us to cope with the problems.
Thank you very much for the interview, Dr. Sawinska. Dr. Beata Sawinska and her team welcome new patients to her clinic. ABM Dental is located at 4240 Wilcox Road. To schedule an appointment, please call 905-272-9966.
Thank you so much.